everyone, I'm Reagan Lokri. Welcome to another segment of Main Street Western Mass. Today we're here with Dr. Hans Vonnahme, and he's the owner of Vonnahme Eye Care in Holyoke. So can you tell us a little bit about what service you provide here at Vonnahme Eye Care?
My wife and I, as owners of Vonnahme Eye Care, we provide full service eye care to patients of all ages. We provide comprehensive eye exams, treatment and management of ocular diseases. We also provide myopia management. We fit contact lenses, and we have a full-service optical center on site with a full-service lab.
And you just mentioned myopia. Can you tell us a little bit about why that's become such a big issue, especially in children?
So let's start with what myopia is. So myopia, also known as nearsightedness, is when distance objects are blurry. And the reason why that is because the eye is abnormally long, which causes light rays to focus in front of the retina instead of on the retina.
So, myopia has become more prevalent. Can you kind of explain why that is?
The increase in myopia is mainly in children. The reasons why that is that kids spend more time on digital devices, they don't spend as much time outdoors, and there's also genetic factors at play as well.
So can you kind of tell us a little bit about what procedures you offer here for children, or really anybody that does have nearsightedness or myopia?
Yeah, so our main goal is to identify the children who may be at risk of progressive myopia. And the way we do that is when kids come in for exams, we not only measure their eyes and their prescriptions and their vision, but we also measure the length of their eyeball, okay? Because what fuels the progression of myopia is when the eyeball starts growing abnormally long. And the reason why that's important is that extra stretching of the tissues in the back of the eye increases chances of many serious eye diseases later in life, such as retinal detachments and myopic maculopathy, which is damage to the macula, the most sensitive part in the back of the eye.
So can you tell us a little bit about what can be done to slow down the progression of myopia in children?
So when we identify children who are at risk of developing progressive myopia, there's three main things that we can do. There's orthokeratology, which is a procedure where we fit children with corneal molds that they sleep with at night, and that corrects their vision, and it also slows down the progression of myopia. There's also soft contact lenses, and there's also special eye drops that can also slow the progression of myopia.
So can you tell us a little bit about how patients can get started on that process and really safeguard their eyesight?
Well, it all starts with getting a comprehensive eye exam. During an eye exam, we'll determine how their vision is, how their eye health is. If it's a child, we'll measure the length of their eyeball and match those up against what they should be for their age. Kind of like a growth chart at the pediatrician's office for height and weight. We can tell if a child's eyeball length is too long for their age.
So do you have any key takeaway points for parents at home watching?
The best thing to do is bring your children in for eye exams, comprehensive eye exams, so we can determine where they're at, and we can measure the length of their eyeball to see what their risk is for developing progressive myopia. Because the most important thing is once the eyeball starts growing abnormally long, we can't undo that. So our goal is to preserve their vision and to preserve their eye health.
Thank you so much, Dr. Vonnahme, for your time today. You gave us lots of great information for everyone at home. And if you want more information, you can call Vonnahme Eye Care in Holyoke. And for now, this was another episode of Main Street Western Mass. Thanks for joining us.